Do you know that ACL is one of the commonest injured ligaments in the body, and worldwide the incidence is increasing? After an ACL injury, you can get back to sports, playing your recreational activities without any hindrance if you undergo a proper ACL rehabilitation and ACL surgery. Greetings, I'm Dr. Kunal Aneja, orthopedic surgeon specializing in sports medicine and arthroscopy at Max Hospital, Shalimar Bagh. Today we are going to talk about anterior cruciate ligament. So ACL or anterior cruciate ligament connects the thigh bone to the leg bone, and it is the central stabilizer of the knee which prevents anteroposterior displacement. Whenever a patient has a pivoting action while playing sports, or they fall from a height, or they have a twisting injury while playing any routine activities, they injure this ligament and they present to us with a loud popping sound from the knee, followed by a lot of swelling, pain and difficulty in bending the knee. We do a thorough clinical examination, follow it up with an MRI and establish the diagnosis of ACL tear, which can be graded in partial or complete. In partial ACL tears, we encourage a lot of physiotherapy, sports rehab, ACL braces and some medications to recover from the condition. Occasionally, patient can be benefited with some form of regenerative injections, which can be autologous conditioned plasma, PRP therapy or growth factor concentrates. It is the last stage, grade 3, which is the complete ACL tear, in which a patient will benefit from arthroscopic ACL reconstruction. Now we have Dr. Rohit with us, who is a sports physio, who will guide us regarding the exercises which needs to be done post ACL reconstruction.
Hi, myself Dr. Rohit Mehta, Zonal Head, Physiotherapy and Rehab Department. ACL reconstruction, anterior cruciate ligament reconstruction, can be turned into 4 parts. In first phase, we try to control swelling, we try to control pain and maintain your normal activity of range of motion and strength. In second phase, we try to build up on your strength. We try to build up on your quadricep muscles, we try to build up on your hamstring muscles. In late post-op phase, we maintain balance and coordination. And in final phase, we customize protocol according to the sports, which sports you want to obtain. You want to go to football, you want to go to cricket or a badminton. We customize protocol according to return back to the sports. If you have ACL injury, grade 1, grade 2 or grade 3, please contact a physiotherapist. He can help you for a better recovery.
Subscribe to our YouTube channel and press the bell icon to get the latest healthcare updates.